And joining us is the chairman of Department-related Parliamentary Standing Committee on Home Affairs, Mr. Anand Sharma. Mr. Sharma, welcome to Rajya Television. You've presented very important reports to the chairman today. Take us through the key observations of the committee.
Well, we have examined the impact of the pandemic, its social and economic fallout, following the imposition of the lockdown, which was unavoidable given the spread of this virus and the fact that other countries in the world, especially in Europe and Americas, had also gone in for partial lockdowns or lockdowns. But the social economic fallout has been very severe, in particular on the weaker sections, poor, on the daily wage earners, daily income earners, the migrant workers. They were affected before mitigating measures were taken. And what we have observed that there is need for a national database for the migrant labor and these such poor people, including the urban poor, as the relief has to reach them. If the government has announced something, it can only reach them once their location, geographic location is there. So India is a vast country, diverse country, and that's where the districts, the subdivisions, and for that matter the municipalities, they all must have that data so that the essential supplies and the relief reaches them. We have also noted the unprecedented disruption in the economy following the shutdown of the factories and the suspension of rail movement, interstate movement, bus traffic, which was part of the lockdown. And that also has now stabilized in the second quarter, which we have observed. One of the observations that we have is that India has shown remarkable resilience despite the challenge. And we have been able to ramp up very quickly our infrastructure. When you look at the number of ICU beds, which have gone up almost 12, 13 times. And similarly, the oxygen-supported ICU beds have quadrupled. Testing laboratories, which were little over 200, are now more than 2,200 in the country. The testing per day has increased hundreds of fold. It is massive testing facilities are available today. In addition to that, when we look at the local manufacture of ventilators, it is taking place now. India is in a position even to send them out. But also the PPE kits and all, from barely few lakhs in March, now today's capacity is 6 crores. But what we've also observed that many of the laws need to be revisited. Whether it's the Migrant Workers Act, the NDMA Act of 2005, which had to be invoked for the management of the pandemic and the lockdown and the phased unlocking of the economy. And in addition to that, the Epidemics Act of 1897. We also have noted glaring shortcomings in the public health infrastructure. And in the initial phases, the poor people were not able to get the insurance cover for COVID treatment, which later got rectified, but it took a couple of months for the insurance regulatory authority to intervene and sort it out. But when the number of beds, ICU beds or beds, we are concerned in the country, in the private hospitals, we have maybe 70% of the beds. But more than 70% of the burden of patients was taken by the government hospitals. So we've recommended more investment in public health infrastructure so that more resources are made available and better facilities for expansion and upgradation of the government hospitals, which actually have been the mainstay during this pandemic. And these, I will say, are some of the key things which we have said. The report is futuristic. It has dealt with every aspect from economy to health and also jobs. and what steps, measures should be taken for mitigating such situations in future. If, God forbid, a pandemic were to descend on the country. This has been an extraordinary crisis, something which has not been seen, but our country was not thrown off balance. India has stood up as one nation, and whether it's the central government, the state governments, and the district administrations, they all have responded. There are many lessons learned, so the report has in fact the conclusions which talks only of the lessons learned and the recommendations.
Well, absolutely, sir. Thank you so much for sharing those details with us. Thanks a lot.